Our children love to have their juices, their bubble tea, and a lot of times these drinks can irritate the bladder and cause wetting. Hello, I'm Dr. Pungkodi. I work as a consultant urologist in Pantai Hospital Kuala Lumpur.
Many people think that pediatric urology is about correcting the appearance of the external genitalia, but there are other aspects to pediatric urology, mainly correcting any condition that may obstruct the urinary tract or cause recurrent infections and eventually lead to chronic kidney disease or end-stage kidney disease in children. Now, the other aspect of pediatric urology is managing patients with bladder dysfunction or bladder disabilities, patients who have wetting, patients who have inability to pass urine, to have these patients lead as normal a life as possible.
Today, I'm here to answer some questions that you may be too embarrassed to ask your doctor. At what age does my son's balls drop? Before birth, the testis is in the abdomen. But by the time a mom reaches full term and due for delivery, the testis would have dropped down to the scrotal sacs. The reason for this is that the temperature outside the body is slightly lower, and this allows sperm to mature completely. Normally, in a patient who has just been delivered and who is a full-term baby, both the testes should be palpable within the scrotal sacs. In a premature baby, there may be some delay, and we give up to 6 months before the testis reaches the scrotal sac. When a patient finds that the testis still hasn't descended completely beyond 6 months of age, most doctors would advise a surgical procedure called orchidopexy. When the testis isn't fully in the scrotum, there is impaired sperm development, and quality of the sperm, number of the sperm would be reduced. Another reason is that in patients with undescended testis, there is a higher risk of cancer when they reach an older age. If we find that the testis hasn't completely descended by 6 months of age, it is good to see a doctor. And when will my child stop wetting the bed? Urinary incontinence in a child is a pretty common complaint that I see in my practice. A lot of times when children come to me, I look at whether they've always been wet or this is something that occurred after they were dry for a period of more than 6 months. I would also like to know whether this is a daytime symptom or whether it's a nighttime symptom. Daytime symptoms of urinary incontinence may be due to incomplete bladder emptying, something that I often see in girls who try to avoid peeing in the toilets in school. Another reason for wetting can be patients who may have an overactive bladder, and these patients often present with urinary frequency, peeing almost every hour, urinary urgency, and waking up many times at night to pee. Commonest reason that I see is the amount of fluids they take and what type of fluids they take. Our children love to have their juices, their bubble tea, and a lot of times these drinks can irritate the bladder and cause wetting. Most children attain full bladder control after 5 years of age. There are some children who are potty trained at a very early age and may have wetting after the period of being potty trained. Is it normal for the child's penis to bend? It is not normal for a child's penis to bend, but often this may only be picked up in the mornings when the penis tends to be erect. Curvature of the penis could be an isolated condition, but more commonly it is associated with another condition called hypospadias, where the urethral opening is slightly below where it should be. And if you feel that your child's penis may be curved, it is often good to seek an evaluation and advice. What is a buried bird? A buried bird in medical terms is called a buried penis. So normally a penis is obvious, but in some patients the penis may not be obvious, and some parents think that their child may have a small penis and often come for evaluation. Most of the time, if the testis is well developed, then it is unlikely that the penis is small. Some of the reasons for buried penis is that a child may be simply chubby, but a lot of times the development of the penis is such that the penis retracts back inside. And in some cases, the foreskin may be too tight and cannot be pulled back, and this leads to an appearance of a buried penis. There are many surgical techniques available for buried penis. it is good that you see a doctor who is familiar with the various surgical techniques and is able to advise you on the correct method. That is all for today. If you have any more questions with regards to urological conditions among women and children, please feel free to leave your questions in the comment section below.